Bacterial keratitis is an inflammation of the cornea, the clear, dome-shaped surface that covers the front of the eye. It is usually caused by an infection with bacteria, although other microorganisms such as fungi and viruses can also cause the condition. The most common symptom of bacterial keratitis is pain in the eye, although other symptoms such as redness, tearing, and light sensitivity may also be present. Bacterial keratitis is a serious condition that can lead to vision loss if left untreated. It is important to seek prompt medical treatment if you think you may have the condition. Early diagnosis and treatment is essential to preventing vision loss. Bacterial keratitis is a rare but serious condition that can cause blindness. It occurs when bacteria infect the cornea, the clear, dome-shaped surface that covers the front of the eye. Bacterial keratitis is most often caused by contact lenses that are not cleaned properly. It can also be caused by injury to the eye, such as a foreign object penetrating the cornea. Treatment for bacterial keratitis usually involves antibiotics, surgery, or a combination of both. In severe cases, a corneal transplant may be necessary. If you suspect that you or someone you know has bacterial keratitis, it is important to see a doctor immediately. Early diagnosis and treatment is critical to preventing complications and preserving vision. It is very important to have a regular selfless eye examination. We should have our eyes examined at least once a year by an optometrist or ophthalmologist. This helps to ensure that we are able to maintain our vision and catch any problems early. It is especially important for those who are over the age of 40, as this is when the risk of developing problems such as cataracts and glaucoma increases. A selfless eye examination is quick and painless, and it could save your sight. So make sure to book an appointment with your local optometrist today.